Hi, I'm Dr. Cole Hosenfeld with Apple Healthcare Group, here with one of my partners, Dr. Bradley Gipson, who's a foot and ankle surgeon, and we're here to talk about plantar fasciitis. Plantar fasciitis, a lot of people have it. We see it. I've gone through it in the past. What is plantar fasciitis, and when is it time to actually see a doctor, and when can they handle it on their own?
Well, plantar fasciitis is one of the most common things I see. It's very common. It starts with really the plantar fascial ligament, which is on the bottom of the foot, being too tight, and also the gastroc muscle, the calf muscle in the back, and Achilles tendon often too tight too. They're all connected in a chain, and it causes the plantar fascial ligament to get inflamed, and you get some little micro tearing in the ligament and inflammation, and it becomes very painful. Most people say it's the most painful in the morning when they first get out of bed, because they've laid in bed all night and their feet have been relaxed and their calves have been relaxed, and it over tightens. In those first few steps, you're getting that little micro tearing every few steps. A lot of people can get better with just doing some simple stretching at home. But I would say if you've been doing stretching, twice a day for 3 or 4 weeks and you've not improved, then that's probably time to come see some. Yes.
So they're going to come in and they see you, right? And typically you're going to do a history on them, where you're talking to them, about what happened, how long has it been going,
right?
That kind of thing. What helps it? What makes it better? What makes it worse? Shoe wear, of course. That's
Absolutely.
a big one.
Yeah.
And so, what is that process? What's the examination process?
Well, we do a physical exam. Also, I normally take X-rays as well, because some people will get a heel spur with that, some don't. We also like to do an X-ray to help rule out a possibility of a stress fracture or maybe something else going on we don't want to miss. And after the exam and the X-rays, we go over the therapy that I want you to do at home and the other treatment plans. We talk about shoes, and inserts are often quite helpful. A rigid to semi-rigid insert is often quite helpful too. People who, I feel like they're having a very hard time getting inflammation out of the area and continued pain, if they've been doing some stretching, a lot of times we'll do an injection. Historically, that's been a steroid injection. But, the overall thing to remember, no matter what you've had done, is you've got to do your stretching at home, even after you're having treatment by the doctor, because that's the most important thing.
So, you examine it, you identify it with X-ray. Sometimes you'll use ultrasound.
Yes, that's right. Yeah, ultrasound's very beneficial. The X-ray, again, we're looking for a heel spur, or ruling out a stress fracture, really. But I do oftentimes use a diagnostic ultrasound, and I can see the ligament. I can see inflammation. Usually in plantar fasciitis, you can measure the ligament, and it'll be very, twice as thick oftentimes than what it normally should be. And sometimes you can find small tears in it.
So typically, initially, you're going to try to get them some home recommendations, go through some therapies in office.
Right.
If they're struggling with that, then it's possibly a steroid shot.
Right.
Now, I will say that I had one of my patients that was raving on you earlier this week, who was telling me that they went through a PRP with you.
Right.
And her results were, she'd had it for years.
Right.
And she went through a couple PRP shots, and she just thought you were the cat's meow. So what is that?
PRP has been fantastic with plantar fasciitis. For people who have had plantar fasciitis a while and are not getting better, or if they just keep having recurrent plantar fasciitis, those are the people I usually approach with PRP. PRP stands for platelet-rich plasma, and our platelets have several different kinds of growth factors in them. We take the patient's own blood and we concentrate those growth factors and inject that into the ligament, and I do that under ultrasound guidance to make sure that I'm getting the medication right where it's needed. And it's stimulating healing and repairing of the ligament itself, and it's been doing wonders for people who haven't been getting better in any other way.
And then from that, the goal is give them exercises, home kind of things to keep building that tissue now that you've helped it heal.
Right, yeah. Even when it's healed, you still want to do some stretching and exercises to keep it from ever coming back.
Yeah. Great. Well, thank you very much.
My pleasure.
If you're experiencing foot pain and would like some help, please go to applehealthcaregroup.com. Thanks for listening.